speed, I have utilized so many resources. Like Harrison based is my favorite part. Harrison based teaching is so good. So I felt like Harrison based teaching from the specialist in speed is so much useful for me, and it will be for every aspirant. Speed allowed me an opportunity to work along with preparing.
So I bring in all the wishes and greetings on behalf of all the faculty members of Speed Medical Institute to Dr. Srihari for scoring AML rank number one, CML rank number one in the specialty of DM Neurology in
Thank you, sir.
session November 2025. Congratulations to you, Doctor.
Thank you very much, sir. I
So
owe a lot to speed.
thank you, Doctor. And great to have you here today. And thanks for sharing your time to share your experiences.
It will
And
be an honor.
great. We wish to know what is your core interest and what is that you wanted to do. And before that, can you briefly share your history from where you started till date, what all you have done?
So I did my MBBS from Maulana Azad Medical College, Delhi. Subsequently, I did my MD Medicine from AIMS Raipur. And then senior residency, I joined in JIPMER. 1 year I did in medicine, and subsequently 4 months I did in neurology. So I want to want to remain in medicine, but at the same time I feel like working with the specialist departments is good to have a point of view how they view their individual specialties. So that's it. So that was one of the reason why I wanted to work closely with neurology, and I had attempted this exam.
Great. And previously, your achievements were rank one in infectious disease and rank one in acute critical
Acute cares.
care. So, I mean, can you share something on that?
Sure, sir. So, like I told, I felt these two branches are also very close to medicine because acute care medicine is a general medicine equivalent of critical care. Critical care medicine is a branch in which the 20 to 30 questions come from anesthesia, but the general paper will be critical care in acute care also. But then for a general medicine aspirant, it will be easy to give the acute care medicine, which has 2 seats in PGI. For a general medicine aspirant, this is better to give because the general questions, 20 questions will be from general medicine, and it will be easier from the background. Critical care is also achievable from general medicine, no doubt about that, but then requires special effort for the anesthesia questions. And then infectious disease, again, definitely another branch which is so closely knit with medicine. If we go to medicine, we realize so much is infectious disease. Either patient come with an infection, or due to hospitalization, there are hospital acquired complications which are infections. So infectious disease is also something which was so rewarding for me to learn and prepare for, because uh, covering a wide spectrum of infections, even transplant infections and all, which I haven't been exposed in MD medicine. That branch was so much rewarding to prepare as well.
So, can you share when did you I mean, what was the exam that you got infectious disease first rank, and what was the exam that you got acute care medicine first rank?
Uh, if last session I haven't given, sir. Before this, immediately 6 months back, I hadn't given. The previous me 1 year back, I had got infectious disease first rank, and before that, 6 months back, I had started with acute care medicine.
Very nice. And now you have given DM neurology and you have got first rank in that. And is there any scope that the new DM neurology will have an opportunity to take Srihari inside, or what is Srihari is going to decide on that?
Honestly, sir, I it's a blessing to learn medicine and learn neurology. The branch is much bigger than me, so I am blessed to have learned neurology.
So is Srihari is planned to join, or is planning to stay with general medicine looking for something else?
Honestly, I am yet to decide, sir. I'll talk with my family, but honestly, general medicine is so tempting to stay by.
What a passion for general medicine, huh? Even in spite of getting top ranks in various specialties, but still yet to go out of general medicine to that specialty to on what he wants to do. And anyway, I mean, it's the first time I'm seeing a person in my 25 years of my medical career. I'm a real passionate person in general medicine after getting the desired ranks, not desired rank, the topmost rank is the rank number one in various specialties that he attempted, but still yet to decide where he has to move on. Such a amazing and a brilliant and wonderful person I have met in my entire career. I'm telling you right now in the screen today before Sri Hari. And because this is the kind of the confidence and the passion and the respect for medicine and for oneself should carry, and he is a standing example for that. I'm really privileged to take an interview with you today.
At the same time, it's an honor having been working with you for the past 1 year, sir. It takes people like you who have achieved so much, but at the same time are humble. So I to aspire and reach this such a rank, it takes someone like you to also model. I have been following you also throughout this 1 year, sir.
Thank you, doctor. Thank you. And thanks for the great words. And can we know how is that going to be from now on? I mean, what is that you're going to do from now on? And what is that you have been preparing to achieve this? I mean, I want to know what is the secret behind achieving repeatedly, consistently rank number one in various specialty exams in INISS.
So honestly, I feel like this time what made a difference in my rank was I had read acute care medicine and infectious disease, so I was a bit comfortable with the general medicine bucket of questions. So of course, 2025 questions from the paper comes from general medicine, and we cannot ignore general medicine considering when every question is rank deciding. So 2025 questions is too many. So I was comfortable a bit with general medicine because I had given two different subjects earlier. But at the same time, I kept my touch with endocrinology and gastroenterology, cardiology, all these branches. Cardiology, I think 3 to 4 questions came this time. So I had revised these. Of course, no, I was focusing on neurology, but at the same time, every day or at least every alternate day, I made a point to revisit some subject in general medicine, and at the same time biostatistics as well. This time 4 questions had come from biostatistics. So honestly, we may or may not like the subject, but the professors in the INIS do research and they will put question in from biostatistics. So again, I had focused a bit of my time in biostatistics. Definitely, I had given maybe 2 to 3 days in biostatistics because I had a gut feeling biostatistics will come, and it paid off. 3 to 4 questions of biostats had come. So one part I would say tell about INI preparation is, of course, a subject preparation is no doubt needed, and that is the core strategy, no doubt about that. But general medicine should not be.
Okay, great. Now, I want to ask you about the paper orientation. How was the neurology paper?
So honestly, neurology paper was a moderate difficulty this time. General medicine was quite easy this time, and that's what popular opinion was also there. And neurology was moderate difficulty. Honestly, after I came back from the exam, I felt like it's an easy level. Then, when I analyzed the recalls, I understood that the easy appearing questions are also difficult level because they were trap questions. So there will be similar 2 options or 3 options, so that while we are busy giving the exam, we might be trapped to think this is the right option, and it might be something else. So when recalls start coming in, we'll realize. So honestly, from this paper, I would give a tip to the aspirants that although the paper might look simple, or every time when you are answering a question, just take back 5 seconds at least and ask yourself, is this the right answer? Or just if you just ask yourself for 5 seconds after every answering every option, is this the right answer? Then you might recognize the traps. So honestly, popular opinion will be it was an easy to moderate level difficulty. I would say it was moderate level difficulty due to so many easy appearing questions which were traps.
Great. Now, can you share something on your interview part?
Sure, sir. Interview, I would personally suggest that irrespective of whatever your CML result will be, like you may think that you will qualify or you may not qualify, irrespective. But I feel like from after the CML exam, after the 80 questions of MCQ you have answered, should keep that behind and start in 1 to 2 days, start preparing for interview, because someone who is preparing for neurology is decided that they want neurology irrespective this time or next time they are going to write the exam. So preparing for interview is always a win-win situation irrespective of the CML result. So I suggest to start preparing for. I personally, I had juniors who had given neurology exam. They had asked me, sir, from the recalls, the way the other aspirants are telling the answers, it seems like my answers are not right. I don't think I'll qualify. And I told that junior, you keep all of these things behind and prepare. And honestly, he got rank 4 in AML. That was a people like fourth rankers can also be uncertain whether they will qualify for the interview or not.
Right.
So
Right.
that uncertainty can come to anyone. So I'll tell to start preparing right off. And interview is the mode of preparation is different from the MCQ. You should not sit and revise MCQ questions and MCQ theory again. Interview, the topics focused are different. The fact based topics won't be focused, but approach based topics will be focused. For example, in neurology clinical examination, neuropathies, myopathies, and motor neuron disease. So these are the things which are clinical examination based. So they may give an image of hand atrophy, or there will be some foot deformity, and they will ask how to approach. Second part is neuroradiology. Neuroradiology is very important. Both my questions were from neuroradiology only. They may show a CT or they may show an MRI. And what they want to know is how we know to read an MRI and report an MRI. It's not about a particular named sign that they want. Named sign is for the MCQ exam. We have to again relearn, not unlearn, but relearn whatever we have learned, so that we can convey it in a fashion that the interviewer wants. Because interviewer wants to know whether I can trust this person to manage the emergency. So they will ask, how will you manage a stroke? So stepwise you have to prepare, like immediately what are the bare minimum investigation I will do before NCCT. In the NCCT, what question will I ask? What will I look for? Things should be very precise in interview, because interviewer will give 2 minutes or 4 minutes. It's written in the document that every aspirant will get 10 to 15 minutes, but honestly no one gets that, because up to 100 people will qualify, so they cannot give 10 to 15 minutes for everyone. So it's very precise interview for 4 to 5 minutes. So prepare answers which are precise and not going all around the topic, and try, you should not say whatever you know about a topic. You should be precise and think that what all are the answers they want. So topics like I told, neuroradiology and clinical neurology.
Great. So before writing the exam, or I mean, what was your idea of this exam? I mean, you thought that you'll get rank number one?
Honestly, sir, I am married to Dr. Amruta Varshini. My wife is doing neurology in Jipmer. So she had cracked neurology 1 year back. She was AML rank 2.
Wow.
So I had an idea about the branch. Honestly, I would say I had an idea about the branch from the start. I had an advantage, and she was there to guide me about interview also. Uh, Honestly, she was correcting my answers and all. So some idea I had already to start with. But at the same time, working in neurology, other residents also in neurology who had cracked this exam had given me their inputs into how the exam is. So honestly, what the input that I got is that stroke and epilepsy is a very big unit that cannot be ignored, because these are the emergency topics which are expected from even an MD medicine. So they will invest a lot of time and questions in stroke, epilepsy. At least I would say, starting with neurology, start with the big topics like stroke, epilepsy, that so that you are not fatigued out, and then subsequently go to the other topics.
Great. Now, what can you share your experience with speed?
Sir, I have been associated with Speed for 1 year. So, Speed, I have utilized so many resources. Like Harrison based is my favorite part. Harrison based teaching is so good, because Harrison honestly is a book, I would say, which to read you need a point of view from the expert also. So because we can read Harrison in UG, we can read Harrison in PG, and after a specialty, the specialist will also read Harrison. I feel like the way Harrison is interpreted or viewed by everyone is different. A specialist will extract out the important things from the topic that a PG, post PG pass out cannot see. So I felt like Harrison based teaching from the specialist in speed is so much useful for me, and it will be for every aspirant, because the general medicine top questions in the INI also come from Harrison. I have noticed that so many general medicine questions were directly taken from Harrison tables this time. So Harrison based learning is something
21 or
useful.
22nd?
Twin Actually, both tables are there in both editions, sir. So they didn't go to the updates. Honestly, the INISS general medicine won't focus on the updates, but they will take the question from the tables only, and those two tables are there in both the editions. And NEET SS, I feel like NEET SS will definitely focus on Harrison updates also, because that is a completely Harrison based
Only
exam.
on Harrison. So, who introduced speed to you?
Speed was introduced to me by my senior sir when my senior doctor Abhishek, he's doing rheumatology in IMS Rishikesh. So in MD medicine I was thinking of joining immunology. I had a plan of joining immunology. Honestly, think plans change all throughout. But that is when I subscribed to speed immunology, and since then I have been associated with speed.
Great, great, wonderful, doctor. What is the message that you want to give to your juniors aspiring for deep specialty?
The message for even for neurology or any specialty is that uh, to during the exam day to keep your cool, because whatever you learned to recall, and also to avoid the silly mistake in trap questions, you have to keep your cool. So prepare well, prepare intensively, but in the last 2 to 3 days don't be tense that I haven't prepared so much, or the exam won't go well, because honestly everyone, no one can prepare neurology fully. Neurology is a vast, one of the most extensive subject of medicine. No one can prepare fully. I also hadn't prepared every possible topic, or I hadn't read any standard book like uh, uh, the Bradley or Adam and Victor from cover to cover. I just went through the book to look at the images. So the images are beautiful and the way they explain are very good, and maybe 2 to 3 sessions of Bradley only I had gone through. So it's not like top rank comes from reading the standard textbook cover to cover or anything. Top rank comes from retaining what you learned. Even if you are learning minimum things, at least you should not lose that. So revision is key. So going through 1 to 2 cycles of revision is key. And before the first cycle of revision, do not think like I will finish all the topics perfectly and then start. Reading everything will not get a rank, because reading everything, once we reach the fifth month of reading, we lose whatever we read in the first month. So focus on revising what you read once or twice.
Great. Time to thank and whom all you want to thank that they have helped you to build you and to make you in this stage in this career.
I will start off by thanking my parents. My parents have been in this journey throughout, from MBBS, from schooling. So even cracking MBBS wouldn't have been possible without them. Then I would like to thank my wife, Dr. Amritavarshini, my in-laws and my uncle. All of us are together as a joint family here in Pondicherry. And my all my friends, relatives, juniors, and faculty, everyone who have helped me throughout at different levels and who have supported me. I would like to thank, I have gratitude for everyone. People like you who inspire me to work towards my goal. And I cannot have imagined uh, being able to prepare at the same time, because speed allowed me an opportunity to work along with preparing. So all of these factors are so much rewarding in the end. And in working with speed, honestly, I felt like I could also brush up my previous topics, and I was learning new things. Even when I was working for the speed in infectious disease material, I was learning new things every time, and that working with speed has helped me improve my knowledge so much, sir. I have so immense gratitude for the opportunity.
Great, doctor. And you will continue to inspire thousands and thousands and lakhs of students in
Thank
years
you,
to
sir.
come in teaching medicine.
Thank
And
you, sir.
classes are really loved by students who are studying in speed. And you yourself is a faculty and you yourself is a student. Back to forth, I mean, this is the first experience where faculty for infectious disease becomes a student for neurology and acute care and scores topmost rank and again gives interview and again becomes and again continues as a faculty. I mean, something incredible, I can tell you, because this is something you are unimaginably brilliant. Not only brilliant, the dedication and the love that you have for medicine is beyond everything. That
Thank you, sir.
I could feel and can sense.
Thank you very much.
General medicine is really blessed to have students like you. Really, I'm telling you. Really, really, really. And once again, I wish you all the very best and all the success as a great faculty in speed and also as a great, great, great student of general medicine. And after the super specialty, once you decide what super specialty you are in, we'll definitely get to know through that. Once
Thank
again,
you, sir.
all the best and all the success.
Thank you very much.